Hey, I'm Dewey Case. Welcome to Unfiltered. I'm the technical director for CMAC, and in my full-time business, full-time days, I'm the assistant aquatic superintendent from Winston County Parks and Rec in Tennessee. We're excited to be here. This is our first Unfiltered. Unfiltered is a short-form interview format where it's me, it's people like Ashley having real conversations about real things that impact public health and aquatics. So I'm going to turn it over to my co-host today and let her tell us a little bit about yourself, Ashley.
Hi, everyone. I'm Ashley Ruminski. I'm actually one of the CMAC ambassadors that was chosen for this year. I am one of the supervisors at a county health department in Ohio. So the county health department is the Cuyahoga County Board of Health, and we oversee about 600 pools in our jurisdiction. So that is just one of the programs that I see.
Great, thanks, Ashley. So, kind of our topic du jour today is breastfeeding. This is something that's come up. We hear about it every year, right? Whether it's water parks or public pools. The last big thing was Australia, right, where a woman was breastfeeding her child in a pool. So, what are Ashley? What are your thoughts on breastfeeding in pools?
So, the first thing I think about is safety. So, when we're talking about breastfeeding, I think more primarily breastfeeding is done on the deck, or maybe the facility has a different space for the family to go to private. But there are also individuals that are more comfortable, I guess you would say, of breastfeeding in the pool. So if they would like to do that or choose to do that, they would just need to do that above the water line for the safety of the child and not be distracted. So I think that is one of the largest things at a pool is being distracted, whether you're holding an infant and you're breastfeeding in the pool, or you're on the deck and you're on your phone or talking to other people and not watching your children in the pool. So those are kind of the things that I think about with breastfeeding. Um, but I think a lot of people have concerns too as the safety of contamination with the lactation or the milk or the spit up that goes into a pool. And really, the most important thing that you have to think of if you're at a facility that's operating as they're required to, they're already following all the standards, their filtration, their water chemistry. So that's already working to handle our normal human contact and bodily fluids such as sweat or saliva. Sometimes people go to the bathroom in the pool and we don't know it. It might be an adult or a child. So I think that is probably the main concern people see, and then just comfortability. They're not comfortable seeing someone else do that.
Yeah, we hear that about contamination. Contamination. It's food in the pool, and I'm just a good old boy from the deep south, right? I'm not. I'm a no BS kind of person. I'm calling BS on that, right? It's with everything that goes into a pool, and if you're following the MAC, it's safe, right? We're not talking about poop. We're talking about a little bit of breast milk and maybe a little bit of spit up, right? It's not contents of the stomach coming out. It's spit up out of the mouth and out of the throat of the baby. And it's so little amount, right? So if you're keeping your pH right, if you're keeping your chlorine right, and you're keeping your turnover and your filtration right, it's really not an issue. There's no data, there's no reported illness, there's no reported outbreaks, there's nothing largely in breast milk that is going to be transferred to a bather. It's just asinine. And honestly, and I know Ashley, you're a mom, right?
Yes.
And a mom to be as well. Um,
Yes.
so I'm definitely interested in hearing just your thoughts as a person, right? I think a lot of times it's someone immature, right? In the case of Australia, we see lifeguards in the most recent case, right? And I think a lot of it's just they're uncomfortable with it,
Mhm.
right? Can you talk about that aspect just from a mother perspective?
Sure. I mean, in this day and age, anyone that is breastfeeding, they're able to do that in a public place. So unfortunately, some people just might not be comfortable with that. But I think it's important, especially at Aquatic Center, we have very young individuals that are lifeguards that, might not be mature enough or might not understand things. And I think it's very important from the top down to explain we do allow this at our facility. They're allowed to do it at the deck. They're allowed to do it in the pool. We have provided maybe a separate private room for them as well. Now, that is just an option for them. You can't require them to go in that private room. But I think just setting up your employees or your lifeguards with that education, that knowledge, giving them the power to know, this is right and this is wrong. The lifeguard might have been 16 and just saw something and wasn't comfortable with it and then told the woman, you can't do that here. There's other people here and children here, and not understanding that. But if we provide our employees with that information, or maybe we have signage that's available too that says we do welcome this, that will help with other people from complaining. You're not going to eliminate the complaining. We know that everybody has something to complain about at any kind of aquatic center. I mean, you're think about your spa. Your spa could be 103 degrees and they want it at 108 because it's
Yeah.
not hot enough. So someone's always going to complain about something, but just setting up your employees to have the knowledge of how to handle a situation. I think that's what they're missing in Australia. That fortunately that lifeguard wasn't prepared for that.
Yeah. And it's crazy for me to think, you know, here we are, we train our 16-year-old lifeguards, 15-year-old lifeguards, you know, how to resuscitate, right? Where we're going to basically compress their chest where ribs break. And, we're going to shock their body with electricity. And we're going to look at a dead body, right? So we train them to do all these things. But then, which includes, by the way, if a woman's coding, you got to bare the chest for the defibrillation pads, right? But we have this situation where, you know, we teach them these things, but somehow there's this disconnect to a totally natural process that's healthy for the baby. It's healthy for the mother, right? Not to be dramatic, but it's not like the moms out there going, woo, right? That's not what's happening. It's just, I think we could do a lot better job there, a lot
Yeah,
better job.
no, I would agree. And personally, I think times have really changed.
Yeah.
I now live in the Cleveland area, if those are familiar with Ohio, and I was from the Youngstown area. So Youngstown area 30, 40 years ago, you didn't really hear breastfeeding or anything like that. Now, at a larger city, this time and age difference, you kind of see, you could be at a restaurant, you could be at a grocery store, you can be at any public setting, and you might see breastfeeding occurring, which is a natural thing that happens. The child needs to be fed, and the mom needs to do what she needs to do, and shouldn't be ridiculed for trying to um, give her child a meal.
Yeah. Well, and it's not just the meal too. It's just, and this is my admonition for everyone. It's, let's get a little bit of maturity, right?
Mm-hmm.
Because this is not a sexualized thing, right? This isn't a woman running around, wanting to be topless just for the effect of being topless, right? And she's not even topless. She's discreet about it. I've never seen anyone breastfeed that wasn't discreet about it, right?
Mm-hmm.
From their own comfort standpoint. Um, but we need to be a little bit more mature about it. We need our staff to be a little bit more mature about it. And if we're going to talk about health, from a public health standpoint, from a human health standpoint, this thing is absolute best for the baby, right? Now, some women can't breastfeed for whatever reason. There's lots of medically valid reasons. Some women don't want to breastfeed for lots of valid reasons, right? Not here to debate that. But when you are breastfeeding, it's the perfect food for a baby, right? It's absolutely healthy. And there's tons and tons of data to support that. We should be supporting that however we can,
Mhm.
not telling moms they need to get out of the pool or cover up out of, sheer ignorance.
Mhm.
So if you can tell, I'm passionate about this.
No, I would agree with that. And,
Yeah.
just like how you stated, I just think they're not trained. They don't have the knowledge. They have no, you don't learn about breastfeeding in school. And if you do, you're definitely, as a 16-year-old boy, you're not paying attention to
Yeah.
it. Unless you're actually, you have a child and you're dealing with that scenario, and then maybe you understand a little bit better. But when something's not affecting you or you're not living that, you just don't understand.
Yeah.
And you need to be able to give people grace and allow them to do what they need to do without judgment.
Yeah. You bring up an interesting point, right? We don't know who these lifeguards are. We don't know who these staff are. I would be curious to see if there's a connection between gender and staff on these events where women are told to cover up, right? Do we see more male staff being uncomfortable with this versus female staff? Is it truly 16-year-olds or is it a bunch of 41-year-olds too, right? I'd be curious to see the sociological data on that. I don't
Yeah,
think
no,
we'll
that
ever get it.
yeah, I don't think we would ever get it either, but
Yeah,
I think that'd be very interesting to see who is uncomfortable. And in my mind, it's a younger generation, but also the older generation, because
yeah,
breastfeeding was something more that was done in private back in the day and at your home and not at a public space. So, just that gap, generational gap, and the changes that we now see in this day and age.
yeah, yeah. I would agree with that. It's an interesting topic.
It is.
Yeah. So I can talk about like the pool side, right? I want
Mhm.
to pick your brain just as a mother, right?
Okay.
Um, I don't know if you breastfeed or not. Not my business, not anybody else's business watching this, right? So I want to make that clear. But, just talking as a mom to other moms, right? Um, is there, I'm a guy, right? I'm obviously not going to be breastfeeding. Is there a best practice for this? Is there an unwritten rule about how you do this, right? What would you as a mother tell other mothers?
I mean, just like any scenario, it's different for each individual. And I just really think you have to do whatever you're comfortable with. Because if you're not comfortable, you're not going to feel safe, and your safety is most important for you and your child. So if you feel comfortable going in a private room that the Aquatic Center has available, then go ahead and do that. If you feel comfortable doing breastfeeding at the deck and it's clean, go ahead and do that. If you feel more comfortable doing it in the water, do whatever works best for you. There's not one way, there's no book there. I mean, there's certainly several books to tell you what to do and what to do, but
Yeah,
all those authors just make it all up. You fake it till you make it. So
yeah,
it's really what works best for you, and what you're comfortable with, in true reality. But I think what I would look at is the cleanliness of the facility, and for me, particularly, just because I'm an inspector, I go to facilities. I want to make sure if I'm going in that water that they maintain that facility, to the standards of the MAC, to make sure that that water quality is safe for me and my child. If you're in the pool and you're breastfeeding there, the water line's below the child, so there's a rare chance that the child will ingest any water, but that's still a risk. So you just always want to play those factors. I certainly wouldn't be going in, you know, uh, probably maybe like a lake that's not maintained and
Yeah.
breastfeeding there, because there's a whole bunch of things that could happen, algae blooms, all that play in factors. So I think just making sure that you're safe and you're educating yourself of where you're at.
Yeah. Probably a well-maintained pool that follows the MAC is probably the best aquatic environment, you
Mhm.
know, that a woman can breastfeed in, if that's the location they're going to do it. Certainly over, our lakes and streams are wonderful, but there's tons of stuff floating around in them. That's for
Yeah,
sure.
yeah.
So, yeah,
And I think too, there is a plus factor in having your child at a young age at aquatic center. The child gets more comfortable with the water. And I mean, unfortunately, in this industry, we see all the drownings that occur. It's
yeah,
not a topic that any of us would like to speak with, but having your child there and be comfortable with the water and know when they can or cannot go in the water when they're older. I think that's a great way to start and transition that education there too.
yeah. Oh, I can't even, as a water safety advocate, old swim instructor, I can't even emphasize how important it is to get them in
Mm,
early as possible, as frequently as possible. You're so spot on with that. So spot on. So, from a pool side, because there's still a lot of people out there thinking that, contamination. One, there's not going to be enough water, on the woman's breast to contaminate the child. The chances of you getting 10 ounces of cryptosporidium, on the nipple for the child to latch on to and get crypto isn't going to be very high, right? That's not a realistic scenario. And if you're following the MAC, you're likely not to have crypto anyway because you've got the preventative practice in place and the treatment practices in place.
mhm,
The water's not, nobody's going underwater to feed their child. That'd be asinine. If a woman's going to breastfeed poolside, they care enough about their child to where they're not going to shove their head underwater to feed. Right. So yeah, it really boils down to, just a maturity aspect, right?
yeah.
So maybe pool operators, maybe managers. I think a couple of things coming out of this is create the right environment for moms, right?
Mhm.
Uh, be open for your staff to allow this, right? Never mind the legal aspect, right? Never mind it's illegal to not allow a woman to breastfeed, but train your staff to be more mature and more open to this thing and not shrink away when exposed to something natural, something healthy, and something that's done in a non-sexualized manner. So,
Yeah. And
yeah,
I think something like a lot of times too that people like to focus on is like the contamination part, like concerned about the breast milk. And we already talked about all the bodily
yeah,
fluids. Like maybe they should focus a little more on all the people that don't shower before they go into a pool because they're bringing a lot of those things into the pool that is more at risk
yep.
of them ingesting than the breast milk. So I think that's just an important thing to factor in that people do not shower at all before going in the pool. And there's some
Very much so. Yeah. I've got to look up the data. I saw the reference the other day. Um, Guy actually researched this, right? But he found that um, an individual carries X number of grams of fecal matter,
Mhm.
on their body. So if you're not, and a rinse shower doesn't do that, right? If you're not taking a soap shower, you're carrying that when you swim.
Mhm.
And basically, you wind up with one form poop, one form turd every day,
Yeah.
if people aren't showering appropriately. I'm much more concerned about that than I am some breast milk getting in the pool. I'm
Yeah.
about as concerned about breast milk in the pool as I am somebody spilling Coke in the pool. It's
Yeah.
it's a non-starter.
Yeah. No,
So
absolutely.
yeah. Ashley, you're our guest. Any final thoughts you want to pass on?
I don't think so. I think just, telling people do what you feel is comfortable and safe for you and your child. And it's hard sometimes, but sometimes you just have to ignore other people and their opinions. And, eventually they'll be
Yep.
comfortable and adapt with the times.
Yeah. They don't matter when it comes to the health of your child.
Yes.
Some Yahoo standing on the pool deck, with no life experience, yelling at you, you know, they don't matter when it comes to your child's health.
Yeah.
So
Yeah.
doctors do, right? Health experts like yourself do, but some dude off to the side, oh, you need to cover up. How horrible! Yeah, get a life, dude. Get a life. So,
Yeah.
all right. Well, Ashley, thank you. You're our inaugural guest. Thank you for being here. It was an interesting topic. Folks, for everybody else watching, we're going to come back with you. After the first, this is going to air in January. We have a very interesting slate lined up for our Unfiltered series. We're excited about it. It's going to be cool. There'll probably be some fireworks. Going back to breastfeeding, right? Go to cmac.org. We do have an evergreen sheet that goes into more discussion on the technical aspect on breastfeeding. Please feel free to go to there and share it and get the word out. So, with that being said, this is Unfiltered. I'm Dewey. This is Ashley. And thank y'all so much.
Thank you, everybody, for tuning in.